Diabetes is a condition in which there is lack of insulin, resulting in an excess of blood sugar in the bloodstream. This causes the blood vessels that feed the nerves to become damaged and reduces the ability of the nerve to repair itself. Dr. Ronald Ongden is a clinical researcher, neurologist, and a neuropsychiatrist located in Sarasota, Florida. He explains how damaged nerves can ultimately lead to very serious complications.
All of our aspects of our body need blood flow, and particularly little nerves in the periphery, such as in our feet and hands, those can get blocked and they can have strokes and therefore cause nerve dysfunction.
There are multiple types of neuropathy, and they range from damage to the nerves of the leg muscles to damage to the nerves in the feet. Sometimes, changes in body temperature of the hands and feet can signify a problem. Kevin Moran is a real estate professional in Sarasota County, Florida.
My symptoms of neuropathy began when I started noticing a tingling in my feet and my toes were cold. I also started wearing socks to bed for the first time in my life.
The symptoms of diabetic neuropathy relate to nerve dysfunction or damaged nerves. Many of the nerves have what they call myelin, which is like insulation. When you take this insulation off a wire, it short circuits. In the same way, our peripheral nerves, when they short circuit, there are resulting symptoms of burning, aching, and cramping. Numbness, tingling, burning, and sharp pains are also a result of damaged nerves short-circuiting. The symptoms of diabetic neuropathy vary from person to person, depending on how they're wired and what other disease states they may have.
One of the most significant consequences of untreated diabetic neuropathy is that sensation is what protects us from the environment. Particularly in the feet, patients can step on nails, injure themselves, and be totally unaware of the damage that has been caused. Because the pain is what's telling us that something is wrong. But if you can't feel pain from damaged nerves, then there's no way of knowing there's been damage to your feet. That ultimately leads to ulcers.
Does it feel the same when I touch you up, higher up and lower down?
A foot ulcer is the precursor to an amputation. In 2006, there were more than 65,000 non-traumatic lower limb amputations. More than 60% were performed on people with diabetes.
Number one is to be aware of their condition, to be on top of their blood sugar control, and watching their diet, as you said, exercise as well, and then keeping close monitoring with a physician, monitoring of blood sugars as well as of available therapies, and being active in their role in their care. Also, one should also be examining one's feet periodically because they can't sense damage, and so one can see the damage sometimes.
Generally, diabetic neuropathy is diagnosed in a doctor's office. The patient may have symptoms of numbness and tingling or pain. Also, there's a neurological examination and a sensory examination of the feet and the hands.
But there are also nerve conduction tests that we do. Unfortunately, nerve conduction tests only measure function of the bigger nerves. So when you have the small nerves being affected, it doesn't show up. And that's where we can do what we call skin biopsies, and we can look at the nerve layers within the skin.
While often the pain is not severe, it can be unrelenting and persistent, and that can have a profound impact on a person's emotional state and dramatically reduce the quality of their life.
This slide shows the symptoms. You know, there are conditions that are associated with neuropathy, particularly painful neuropathy, because pain is your body telling you something is wrong. So when you have numbness and tingling and burning sensations and aching in your feet, you don't sleep well.
My most pronounced symptom was insomnia because the coldness of my toes and the numbness would aggravate and irritate my ability to get a good night's sleep. Subsequently, I was up several times a night.
The first time in my life I'm wearing socks to bed.
Okay, let me examine you again and tell me if you see a difference as I go up, if you see a difference in sensation. These symptoms are exacerbated. And also, it turns out that the neuropathic symptoms that our brain perceives are dictated by two brain chemicals called norepinephrine and serotonin. Serotonin, as you probably know, is related to moods. So it turns out both physical pain from neuropathic pain, from neuropathy, as well as emotional pain, depression, anxiety, are subserved by the same brain chemicals. When one has physical pain, one suffers from emotional pain to some degree. When one has emotional pain, one perceives physical pain more acutely as well. So the two are tied in together.
The neuropathy that I'm experiencing on a personal level has limited my ability to get a good night's sleep. On a professional level, I grin and bear it and just get on with it.
Coming up, we'll see what treatments are available for diabetic neuropathy. More than 25 million people in the U.S. have diabetes. The costs of the disease are staggering, a total of $245 billion in direct medical costs and reduced productivity. After adjusting for population age and gender differences, the average medical expenditures among people with diagnosed diabetes were more than 2 times higher than what the expenditures would be in the absence of diabetes.
Well, one should always take advantage of seeking out the best advice they can in a physician, and I would suggest that anyone suffering from neuropathy or the symptoms thereof to seek out a good neurosurgeon or a neurologist who can interface with them, who can answer their questions and is willing to take the time to listen to their symptoms.
However, there are medications that are approved for the pain associated with neuropathy. Others used are antidepressants, cardiac medications, some anticonvulsive agents, medical foods, and supplements.
I think since we know the damage potential of diabetic peripheral neuropathy, I think we'll be much more aggressive, not only in terms of diagnosing it, but in terms of treating it. Many years ago, we didn't have the nerve biopsies and the skin biopsies to give us a clear assessment of what the nerve damage was. So I think we're making progress, and we'll be incorporating that progress into treatment and medications.
You got to individualize. If someone is getting side effects, stop the medication. And there'll be a few unfortunate people who get very serious side effects from medication. But that shouldn't stop us from looking for medications.
One last thing I'd like to add is never give up. Medicine is constantly moving forward. And by seeking out Dr. Onden, I've learned some pretty amazing things, and I'm very pleased.
I'm Dr. Ronald Ong Din, inventor of the direct effects medicated cream my patient Kevin uses for his neuropathy. I've been granted 7 patents in the United States and abroad. The therapy is quite different from others. Direct effects cream is applied to the skin of feet, legs, and other affected areas. Unlike many medications taken by mouth, it works almost immediately. Benefit is noted within 10 to 15 minutes. You may note decreased pain, reduced numbness and tingling, decreased swelling. There may be improvement in color as blood flow is restored. The direct effects cream is generally applied 2 to 3 times a day, but in time, this may be reduced as the condition improves. Direct effects medical cream not only treats symptoms, but may act to reverse the process of nerve damage. Key ingredients in it allow this to occur. Most medications for neuropathy only treat symptoms. Finally, it is applied to the skin and works directly on damaged nerves, and as such, there are no side effects or interactions with other medications. In summary, direct effects topical therapy is simple and effective. It may change the course of disease and improve the lives of those suffering from neuropathy from diabetes and other causes. Thank you for your attention.